Okay, so let's talk about what to consider when buying an intraoral scanner. First up on our list of things to consider is the hardware consideration. Then we'll talk about the scanning capabilities, the workflow integrations, and finally, the cost. So, scanning hardware. Got some pictures up here. One is some hands with a ruler, and another one is a nice little picture of some wired versus wireless network. So I really want to talk about first the size and the ergonomics. How big is the scanner? Some people have big hands, some people have small hands. Most people in the dental world spend a lot of time being very dexterous with their hands so they can move scanners about quite easily. But it is important to consider the ergonomics of the scanner, so how big it is. Is it a pistol grip, like a water gun, or is it a pen grip that you might hold in, sometimes I call the javelin grip, or the shopping bag grip, or the pen grip, or the chopsticks grip, depending on how you wish to hold it. There's many different ways of doing this. Also, there's wired and wireless. So a wireless scanner, obviously you could walk around the room wherever you choose, or a wired scanner, you are bound somewhat by the length of the cable. Also the length of the power cable and whether you're moving around with a cart and other things like that. Thinking more about the scanner hardware, how many cameras are in the scanner? Some, such as the Trios scanner, have a single camera with a white light. Obviously, with a single camera, we have to move the camera from point to point in order to get a 3D object. Just like covering up one eye with your hand, you can only see in 2 dimensions. Your depth perception is not very good. Other scanners, such as the Medit i500, have 2 cameras very close to each other, but they are separated by some distance, so they do have binocular vision. And this picture here I've got of the cube with the purple view and the green view shows a little infographic as to what binocular vision is. Also, is the camera monochrome, so black and white or with gray, or is it color? I've got a picture of space, the nebula somewhere here to show the difference. It's the same image, just a different filter applied. So what we need to think about is color necessary clinically? If you're doing orthodontics, you don't really care about the color, do you? All you care about is the location and shape of the teeth. Whereas if you're doing margin detection, there might be a bit of blood or a subgingival margin. You want to look at the color and see, okay, exactly where is my margin? So thinking about, do I need or do I not need color? Oh, back a slide. Scanning hardware, some more information about the computer. So do you want a BYO laptop or will there be an included PC? You can see I've got a picture of a man here standing at a little rolly desk or stand. With this, you can use any laptop you choose. You might want to custom spec out a laptop, make it really grunty, or over years, you may wish to upgrade the PC, put in some more RAM or a fancier graphics card. And also a laptop that is portable, so you could fold it up at the end of the day and take it to another clinic or another location you go to visit patients. Or you can have the option of a cart, or like Trios have, a move. You can see in the picture on the right there of the lady scanning the man. They've got a Trios move, and it's got the extendable gooseneck arm with a touchscreen, which is very easy to move around from place to place. Thinking about touchscreens, you also need to consider hygiene. So are you going to have a glove on and touching the patient's mouth, then touching the screen and back and forth? What are you going to do about that? Or are you going to use a mouse with a laptop? Or some scanners even have a gyroscope inside, so you can tilt them and move them about like a mouse on screen, and then use the button on the scanner as your mouse button. Other options are to get a little iPad stand and use some software such as Splashtop, which will take your screen image and project it via your Wi-Fi onto your iPad. We have a few customers using this situation in orthodontic clinics where they're scanning a patient what seems like every 5 minutes. So they walk around with a wireless scanner in one hand, iPad in the other, and just walk from chair to chair to chair. So thinking about the ergonomics of this, as well as the grunt of the computer you're using, are always good considerations. Next up, we have to think about the scanning capabilities in terms of the scanner itself. We talked about the number of cameras and the light used. How is this light important? I've got here a picture from some indoor lighting website, but you can see the difference between a whitish light and a maybe even bluish light and a yellowish light. So it depends. If you want to do shade taking for restorative or crown and bridge, it's really important to have a white light, like a medical grade white light that is, and to calibrate it well against a color palette of known reds and greens and blues, etc. So you can very accurately say this is an A2 or this is a B3 on the stump or whatever it may be. Or if all you want to do is scan quickly and not care about the color, maybe your blue light's really handy, and that way you can have a really accurate scan. Also thinking about what objects you will be scanning. Are they shiny, such as a metal crown in the posterior from an older restoration? Sometimes those are a bit more difficult to scan, or say an RPD with a clasp. That might be a bit difficult to scan, depending on how shiny it is. So different scanners have different abilities to deal with this shiny reflective surface. Some use filtering, some use hardware. It's good to investigate what sort of filtering options your scanner has, and think about in the future what sort of restorations or existing restorations will you be scanning. Also, there's things such as artificial intelligence, a big buzzword at the moment, AI, machine learning. What's really clever about AI and the scanning software is you can do things like auto tongue removal. Obviously, we don't want to be scanning the tongue when we're scanning teeth. And if the software is clever enough to recognize that surface shape and the texture of a tongue that we all know, it can be removed automatically by the software. There's also an option to do scan body capture. So you can see here we capture the scan body. This tells us the location of the implant, and from there we can do some restorative work in the lab. Also, when it comes to scanning capabilities, we've got to think about speed. Everyone talks about speed. Is it 15 seconds? Is it 17 seconds? You can throw many numbers out there, but what it really comes down to is the software and the user. I often say I can sell you a Ferrari, but if you're not Michael Schumacher, it's not going to drive like you want it to. So you could be a learner driver with your scanner, and you will not be as fast as someone who's been scanning for 5 years. So there is a learning curve, and each scanner is different. Each scanner has a different technique. Some scanners you rock over the anterior teeth. Some scanners you move quite slowly and deliberately. Some you can move really quickly. It all depends on what the technique recommended by the manufacturer is. And when I say the software is important, we must realize that the scanner is capturing hundreds or even thousands of photos per second. It's up to the software to take all those photos and make something of it. And as we know, software gets regularly updated. So thinking about what is included in your software, are there different modes? Some have a classic mode or an insane mode, or an AI mode, different filtering settings as well. So thinking about the software and also the user, what you're going to be doing, who's going to be doing the scanning. Is it the dentist or the orthodontist or the prosthodontist, or is it a nurse or another staff member? All good things to consider. Also, accuracy and precision. There are many studies published by many different universities around the world saying this scanner is this accurate to a certain microns plus or minus a certain error factor. You can read all these studies, but it all depends on technique and different parameters. So I've put a photo up here of an iPhone taking a panorama of what looks like New York City. With the iPhone panorama, you have to slowly move from left to right and keep the image within the little frame they've put on screen. There's a very deliberate technique to it. If you move too quickly or jolt about, then you might not get the result you want. It's all about the software having to stitch one image to the next one, to the next one, to the next one. So the accuracy and precision can be quite significantly affected by the technique of the user, just like the speed can. And also parameters of how you overlay a model scanned with $1 million desktop scanner compared to your $30,000 intraoral scanner. What parameters are you using to define the accuracy and precision? And accuracy and precision are different things. I can throw a dart at a bullseye and I can miss. So I'm not very accurate, but I can say I know exactly where I am when I've missed, and there's my precision. So more things to consider as well. Next, we'll move on to workflow integration. A lot of scanners start off with the scan and send model, where you outsource all the work, or you're just doing patient records. Sending, hence I've got my picture of my British postbox. You can send via a cloud service offered by the scanner manufacturer, whether it's 3Shape Communicate or MeditLink or Cadent or whatever it may be. There's many different services provided, and this is what we're seeing as a trend going forward, is infinite or a huge amount of online scan storage for you, so you can get rid of that garage or that storage unit full of stone models from the 90s or something. As you can see, this poor lady here is having to hunt through them and worrying that maybe the writing's faded or the model's chipped. Obviously, having all your information digitally stored is a huge advantage. Also, when you're sending, can you just export via an STL or other file format? Can you do that immediately, or do you have to go to another software to have it cleaned up? And how are you going to send it? Is it going to go to your computer and then you're going to give it to your colleague on Dropbox, or will you email it, or other workflow considerations? Next in the list of workflow integrations, we can think about, well, are we going to do any diagnostics as part of our workflow integration? Do we want to use an infrared light on the scanner to look for caries, say? Or do we want to look at the occlusion map to show a patient, well, we can see you're grinding, or maybe your tooth has gone missing, so we can see there's this gap formed. These are all part of the workflow integrations that are interesting to consider when buying an intraoral scanner. Another one to consider is these patient excitement apps, as 3Shape call them. They've got some here. Down the bottom left, we can see there's the smile design, where you take a photo of the patient and then design some pretty new teeth and show the patient, here is an option for your teeth. We can make you look like this. Other options on the right, we see the patient monitoring, where you take a scanner from sometime in the past and then another one and then one today and then maybe you want to get in the future, and you can overlay them all digitally and see how much has a tooth moved from orthodontic treatment, or from wear, from grinding at night, or maybe someone's got a chip in their tooth and it is worn away. All different options available with different software. This is also really good for patient education. You can show them, look, we've taken a scan of you every 6 months, and that chip that you've got in your central or wherever it may be is wearing away. We need to do something about this. And that can drive more treatment acceptance with education. Also, we can have patient communication apps. So this is a screenshot of 3Shape's Communicate app on an iPhone. You can scan the patient, send it to them, and they can look at it on their phone, or you can communicate with a lab or another referring clinician to look at what options there are. More workflow integrations. Well, let's look at all the different things you could design once you've taken a digital scan. Obviously, crown and bridge is the starting point. A lot of clinics would like to do temporaries, or some virtual wax-ups and other options like that, or some quick turnaround retainers for orthodontics, or maybe some bite splints. Obviously, all of these can be 3D printed, hence I've got a picture of a new Form 3B available. So if you're interested in doing some in-house workflows, you can look at a printer. Talking about this CAD software, well, do you want to do same-day dentistry for a crown or a temporary or something? Or are you going to outsource to a lab who can do more complicated work for you? And when we talk about 3D printing models, what CAD software is required to make the model 3D printable or watertight, or putting a base on it? Is that done automatically by the scan software, or do we need to go to another CAD software to trim off what we don't want and maybe put an articulator or a name on the model before printing? Also, what hole closing algorithms are there? If you've missed a patch with a scan and you're going to print it, you have to make sure that the model is watertight. So it's good to consider what your workflow is going to be, and is this included in your scanner, or do you need some additional software? Another option for workflow integrations is a full integration. So for example, On the right here, we have some implant planning, where we scan first, then we design our implant location, we design our surgical guide, and then we can 3D print this. Crown and bridge is a very popular one as well. We spoke just before about crown and bridge and temporaries and veneers. Or whether you're doing all-on-4, so you're doing some complicated work there. Will you scan the existing denture and then scan the patient's soft tissue on its own and align those and then send it off to the lab for planning of all-on-4 or maybe a duplicate of a denture? Other options are orthodontics as well. What will you be doing there? Will you be manufacturing in-house? Will you be using a clear aligner provider service? How do they integrate with your scan? And lastly, the slide everyone wants to talk about is costs. So what are the upfront costs? Some scanners are $20,000 Australian, some can be $50,000 Australian. This includes the wired or wireless option, color, monochrome. Does it come with a cart? Do you supply your own PC? What are all your options here? So there's a bit of price variance too. Do you have the Carrie's diagnostic aid as well? Hence, there's this range in cost. I spoke about bringing your own PC. Do you want to have a really high-spec laptop that you can take around? Or if you're going to be scanning in the same location all the time, do you want to have a cart or a really grunty PC? Is it going to be wired or wireless? And all these software inclusions we've just spoken about. There's a lot to consider. What is the cost of the scanner on its own, and what is the rest of it cost as well? Then some companies even offer a scanner free with a certain number of lab cases per month. That is an option we've seen be popular in the past few years with labs selling scanners to clinics. Is that something you want to commit to? Or do you want to have total freedom as to where you send your work? Then there's the option of annual fees. Some scanners, you buy the scanner, it's yours, off you go. You can have it forever, scan forever. Others, you have to pay an annual fee. This can pay for upkeep of new software, pay for support, of course, which is very important. You have to think about, what are my annual fees long term? Do you want to prepay a higher amount at the start, at the initial purchase, so your annual fees are lower? The scanner shouldn't just be a single one-time purchase. You have to think about it as a 3 to 5 year investment. What's the average cost per year if you take the initial cost plus the annual fee and average it over all those years? Some are free, as I mentioned. Some are up to $6,000 per year just for scanning. So it really depends on what you want to do. As I said, the software inclusions, of course. And then scan tips. All these scan tips have to be sterilized between patients, of course. How much does a single scan tip cost? How many autoclave cycles does it last? How many are in a pack? So again, there's an investment there. Some last 50 autoclave cycles, some last 150. Do you average that out over 5 years, or do you work that into a month or a year, depending on how busy you are? So that's come to the end of our webinar. Quite a few interesting things to consider if you are looking into purchasing an intraoral scanner. Of course, please stay up to date with our newsletters and follow us on social media. And if you do have any questions, please reach out to us at Dental Access. Thank you very much. Bye.